So we've been seeing a number of football players in the clinic recently with hip and groin pain, and one of the common presentations that we see is this posterior abdominal wall defect. And I think a common classification of patient that we see is when they have this uncontrolled lumbar extension, anterior pelvic tilt, and it opens up that posterior abdominal wall. So when they're playing, running around, doing their kicking sports, they're constantly working in that distended posterior abdominal wall position. So a good example here is Tom. So we'll just do a test which will demonstrate that uncontrolled extension. So if you just fold your arms. So Tom, if you just naturally raise your left leg up into the air. And what we can see is Tom does that movement there, we see that gap underneath his lumbar spine, so he's going into that uncontrolled lumbar extension. Actually, if he does it with two legs, it will possibly be even worse than that. And relax back down. So what's happening there is he's going into anterior tilt, the posterior abdominal wall's in that stretch position, he's going into actually relative hip flexion as well, which will irritate the hip joint. So working on that inner range abdominal control is something that we need to put into place in this type of player. So we'll go ahead and show you how we can do that. So we'll just take you through a few exercise progressions which can combat that inner range abdominal strength deficit. The first one, just quite a nice easy sit up. So put the block underneath the legs, it just takes the legs out of it and the weight of the hip away. Tom, you're going to put your hands through the middle and we're going to work this inner range. So the idea here is he reaches forward and then doesn't allow himself to drop back, and we really want to work him in that inner range of that abdomen. So he's almost forced to stay in a bit of posterior tilt, and we get a lot of abdominal work here, both rectus and oblique, but it's just really working that inner range of the abdomen. We can also modify that by just changing it up a little bit. So we go to the sides, Tom, so if you slide your hands down each side, so really go left and right, so really stay up, small movements. And we really want to isolate these muscles here, but working in their inner range so they don't come under that stretch. And then we can go into rotation as well. So if you just rotate to your right, Tom, good. And then here's some nice progressions for maintaining that posterior pelvic tilt using the gym ball. So the first one is the sort of classic dead bug. We use the ball here just to give the stimulus to the player, something to push against. And what we're really important is that we've got this flat back against the floor. So we've maintained that, so core drawn in, and then we're going to go opposite arm, opposite leg, just a small release, but making sure that we maintain that neutral spine so we're not dropping into an anterior tilt on that side. So that's the first sort of basic one. And then if we come into the second progression, the second progression is in this press up position. So again, we're looking to try and maintain that neutral pelvic posture, not allowing Tom to drop into anterior tilt. So we're looking at Tom now. So we're going to keep this gap relatively low and you're going to bring the ball underneath you, Tom. Good, and then come back out. And again, same thing again, keep drawn in. Good, and back out. And one more flex up. Good, and back out. And then you can relax out. And then the progression from that is to go into this roll back exercise. So that first one wasn't too bad. This one might be a little bit of a struggle for Tom. So the same thing, Tom, we're looking at maintaining that neutral sort of support. So we're going to just tuck your chin in a fraction there. And then we're going to do the same roll back position, okay? So roll back into it and then come back out, okay? So trying to keep that abdominal wall in, go again. Good, and then come back out and relax back out. So not bad, but we just see a little bit of Tom struggling to maintain some of that extension towards the end. So that exercise is probably a bit of a challenge for him towards the end. But that's just the three progressions for maintaining a neutral spine